My name is Sunit Godambe, and I'm a neonatologist and a pediatrician. Uh, I've been a consultant neonatologist and a pediatrician for the last 20 years. And I work on the NHS as a consultant neonatologist at Imperial College Healthcare NHS Trust, which includes the hospitals of St. Mary's at Paddington and Queen Charlotte and Chelsea Hospital at Hammersmith. Um, in addition to my NHS practice, I also have a private practice, and I have 3 clinics at present. Um, I have private practice on Lindo Wing, which is a part of the St. Mary's Hospital at Paddington. I also do private practice at St. John's and St. Elizabeth Hospital, which is at St. John's Wood. And my last clinic is at London, and my third clinic is at London Medical, which is on Marylebone High Street. I chose to be a doctor because I was sort of grilled into being a doctor from beginning by my parents. Being born Indian, we had only 2 options: either become a doctor or become an engineer. And I chose to become a doctor. Uh, um, Unlike my 2 elder brothers who actually took up non-medical professions. But as I entered medical school, I started enjoying it. Although I must say that my first instinct was to leave because I used to be petrified of blood initially. So it's a journey, but I enjoyed being a doctor now. I don't think I can do anything else other than being a doctor. I think that's again come by default, if you ask me. I clearly liked the children. I enjoyed looking after my nephews and nieces when I was a teenager. But that was because I was always probably a bit soft-hearted. Uh, I took up pediatrics because that was the most desired branch in when I was in India. Uh, and people who were on top of the scores always took pediatrics because it was a very important specialty. So I took up pediatrics by default. But I started enjoying it after I started my career as a pediatrician, and my few years as a trainee made me more intrigued into learning more about pediatrics. And that's because uh, I believe pediatrics is so much unsaid. It's I compare it more like a veterinary practice where children can't express themselves, but you see them in pain. Uh, and you try to guess what's wrong with them, and when you're right, you feel rewarded. You feel that you've actually made a big difference. But the more important is you make a big difference to the parents, because um, 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 especially when I become a parent now, and you realize, when you're a parent, how important your child is. So I have parents who still remember when I've seen their child 17, 18 years ago, and they still think what a great thing they had done. Sometimes, I smile, but I don't remember what I really did. But that's why I like pediatrics. Because it's so rewarding. I think the most rewarding thing about the job is the satisfaction that it gives me. I go to bed thinking that I've done something nice today. I get up from the bed thinking that I'm going to do something good today. So I think that's what's nice about pediatrics. There's a lot of untold things in pediatrics, in the sense we all know that children don't really express themselves, and there's no thank yous from the children, but there's a lot of appreciation from the parents. There's a smile from the child that makes your day. And when the parents smile in addition to the child, you really feel very happy and satisfied. I think that's really what I like about pediatrics. my understanding is my patients value my time, my patients value my patience, actually. um, and I like to listen. I like to understand what the problem is, and once I understand the problem, then it becomes easy to get a solution. I guess that's more so. I will not rush through any consultation. I like to spend time. I like to understand, and I like to take a holistic approach to my patients. I will also chat with parents to make sure that there's anything else that I might be missing. Sometimes I feel listening to the parents gives me more information because obviously they've spent more time with the child. And in addition to being medically knowledgeable, I still feel parents give a lot of information that helps to reach the diagnosis. Um, so I think my time, my patience, and my listening capacity is what really makes a difference, and that's what patients probably like.